The COVID-19 caseload in Delhi crossed 50,000 even as the surge in infection continues to rise each day. As per government data, the death toll in Delhi has already crossed 2,000 and the recovery rate is also deteriorating. Nearly 73% of the total deaths due to COVID-19 have been reported since June 1st. The case fatality rate CFR is 4% compared with the national average of 3%. CFR in epidemiology refers to the proportion of people who die from a specified disease among all individuals diagnosed with the disease. Gujarat has the highest CFR in the country at 6.2%, followed by Maharashtra 4.7%. The CFR in UP, which has reported 15,932 COVID-19 cases till date, is 4%, the same as Delhi. Experts said high CFR could be reflective of wider spread of the infection. The number of people affected by COVID-19 in Delhi may be much higher than what the data shows. This will be clear in the days to come as we test more people, said a senior doctor. Over the last 3 days, testing for COVID-19 has gone up from approximately 5,500 to over 8,000 samples daily. On Thursday, the government said 8,276 samples were tested in 24 hours. The active cases of COVID-19 are above 28,000 in Delhi, which is the highest in the country after Maharashtra with 53,915 cases. While most of the patients have mild symptoms and are being managed under home isolation or at COVID health and care centers, 20% of the active cases are admitted in various hospitals. Of these, 249 are in critical condition requiring ventilator support. About 850 others are admitted to the ICUs of various hospitals, officials said. Doctors said Delhi needed to ramp up the number of ICU and ventilator beds on an urgent basis because the number of patients was likely to go up as new cases come to light. The health of the elderly people with comorbidities like diabetes, heart disease and other chronic illnesses often deteriorate suddenly on the 7th to 10th day of the infection, a doctor said. In such cases, they will require critical support like high-flown oxygen or ventilator support immediately. Any delay can be life-threatening, said a doctor. According to the data, more than 75% of ventilator beds in Delhi were running full as on Friday. Critical care specialists said given the speed at which new cases were being reported, Delhi may soon be starting at a crisis of ventilator beds. The Delhi government has been making false claims on the preparedness to deal with the pandemic, but ground reality is different. As predicted by the Delhi government that by end of July the cases will reach 5.5 lakh, the healthcare facilities will not be able to cater to even 10% of the total patients.